Hello and welcome to Real Response's COVID-19 training package on personal protective equipment. My name is Brett Moret and I'll be taking you through a few different things to learn about personal protective equipment surrounding COVID-19. What we're going to look at today and cover is the standard precautions associated with protecting yourself against COVID-19, some of the transmission methods, including contact, droplet, and the aerosol method, how COVID-19 is transmitted in the community, what personal protective equipment you can use to better protect yourself against COVID-19, and how and when to apply the personal protective equipment appropriately and effectively. We're then going to finish up on how to clean those surfaces around your home and the workplace to ensure that we can adequately kill the virus and prevent it from spreading around the community and your home. First of all, what we're going to look at is how COVID-19 is transmitted from person to person, and how you can actually contract the disease out in the community, at your workplace, in hospitals, and at your home as well. We're first going to touch on the contact method, the droplet method, and also the aerosol transmission method. What we have next is just a short video to discuss these different methods. What we're looking at here is the direct contact transmission of COVID-19. First of all, what is the direct contact transmission? So the contact transmission includes direct contact or indirect contact. Person-to-person transmission is a form of direct contact transmission. Here, the agent, the virus, or the pathogen is transmitted by physical contact between two individuals through actions such as touching, kissing, sexual intercourse, or droplet sprays. Indirect contact transmission involves inanimate objects called fomites that become contaminated by pathogens from an infected individual or reservoir. Droplets land on a fomite such as a tablecloth or carpet, or the individual may wipe her nose and then transfer mucus to a fomite such as a doorknob or towel. The droplet transmission, which is seen to be the most common form of method for transmitting the COVID-19 disease. Infections can spread when an infected person talks, coughs, or sneezes. Small droplets containing infectious agents travel into the air. The aerosol transmission method. Airborne transmission may be possible in specific circumstances and settings in which procedures that generate aerosols are performed. These can include the endotracheal intubation, a bronchoscopy, open suctioning, administration of nebulized treatment, manual ventilation before intubation, turning the patient to the prone position, disconnecting the patient from the ventilator, non-invasive positive pressure ventilation, tracheostomy, and potentially CPR, cardiopulmonary resuscitation. It's important to note that analysis of over 75,000 COVID-19 cases in China, airborne transmission was not reported as the main method or mode of the disease virus spreading. So how is COVID-19 spreading? How are we actually going to catch this virus when we're out in the community, at home, on an aeroplane, in public places? According to the World Health Organization, the main transmission method they have discovered for COVID-19 is the droplet method and the contact method. There are currently studies being conducted that are looking at other possible methods of transmission, but these are yet to be confirmed. So it's really important that we are practicing effective and quality hand hygiene when we're out in public. We're not touching our faces, touching our nose, touching our eyes when we've been in contact with public surfaces that we're not sure whether they've been cleaned properly or not. The droplet method as well is just taking necessary precautions when you're around individuals, not standing too close, maintaining that social distancing. So if they are infected and some droplets are leaving that individual, you're not within that 1 meter range where you can become in contact or those droplets can land on your surfaces. Again, if you're out in public, making sure that you adopt those basic hand hygiene principles. And every time you touch something, we're wiping our hands clean and we're avoiding touching our face in the event when we're out in public. When it comes to having PPE, there's a few myths out there that we want to dispel. What we're first going to look at is when you actually need to use a mask and how we have to use them properly. We just have a few short videos to show you and demonstrate.
Medical masks like this one cannot protect against the new coronavirus when used alone. When you wear them, you must combine with hand hygiene and other preventive measures. WHO only recommends the use of masks in specific cases. If you have cough, fever, and difficulty breathing, you should wear a mask and seek medical care. If you do not have these symptoms, you do not have to wear masks because there is no evidence that they protect people who are not sick. However, if you are healthy, but you are taking care of a person who may be infected with the new coronavirus, then you should wear a mask whenever you are in the same room with that person. And remember, if you choose to wear a mask, use it and discard it properly and clean your hands with alcohol hand rub or soap and water. For more information on mask use, other preventive measures, and the new coronavirus, check WHO website at who.int.
If you do not have any respiratory symptoms such as fever, cough, or runny nose, you do not need to wear a medical mask like this one. Mask alone can give you a false feeling of protection and can even be a source of infection when not used correctly. Masks should only be used by healthcare workers, caretakers, or by people who are sick with symptoms of fever and cough. Why? Because healthcare workers and caretakers are in close contact with ill individuals, so they're at higher risk of catching COVID-19. And sick people should wear masks to protect others from small droplets that can come out when they cough or sneeze. So, for healthcare workers, caretakers, or individuals who have fever and cough, this is how you should wear a mask. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. Inspect the mask for tears or holes. Verify which side is the top. This is where the metal piece is. Then identify the inside of the mask, which is usually the white side. Then fit the mask on your face. Pinch the metal strip or stiff edge so it holds to the shape of your nose. Adjust the mask over your face, covering your mouth and chin, making sure there are no gaps between your face and the mask. Do not touch the front of the mask while using it to avoid contamination. If you accidentally touch it, clean your hands. To take off the mask, remove the elastics from behind without touching the front and keep it away from your face. Discard the mask immediately in a closed bin and clean your hands. It is important not to reuse the mask. Replace it with a new one as soon as it gets damp. And remember, the best way to protect yourself from the new coronavirus is frequently cleaning your hands with alcohol-based hand rub or soap and water. Stay safe and see you next time.
What we're going to discuss next is the cleaning tips that you can implement at your home and your workplace to make sure we're doing this effectively to stop the spread of coronavirus. There's a few reasons we need to do this, and the main one is that the virus can stay stagnant on different surfaces for a different period of times. What we're going to look at is what products you need to use, how you need to clean, and what areas you need to clean around the house. What we need to understand is that the estimated median half-life of the coronavirus is approximately 5.5 hours on stainless steel and 6.8 hours on plastic. Viable virus could not be detected on copper after 4 hours or after 24 hours on cardboard. The virus has survived best on plastic and stainless steel, remaining viable for up to 72 hours, although its overall concentration fell significantly by that time. So when we're cleaning, we need to make sure we're doing this effectively so that we can completely kill the virus and stop the spread. So in conclusion, the coronavirus is currently a pandemic that is having catastrophic effects around the globe. Please remember to follow all recommendations highlighted by the World Health Organization. Basic hand hygiene, avoiding touching your face, mouth, eyes after coming in contact with a public surface is essential. The elderly are most at risk, along with individuals with pre-existing medical conditions. If you do develop symptoms, please contact the hotline to seek advice on 1-800-022-222. Thank you very much for watching, and please stay safe.